Hi, I'm Dr. Matthew Norton, founder of People Plus Purpose, and your host on this episode of the Truth Behind Dentistry podcast. And today we are fortunate to be joined by mental health professional Bonnie Brindle. Bonnie has a master's degree in education. She provides transformational coaching and teletherapy, including evidence-based anxiety support for high-level healthcare professionals in the dental, medical, and veterinary domains. She is also the author of the forthcoming book, Cracking the Crazy Maker's Code, Wrestling Real-Life Anxiety to Win. So welcome, Bonnie.
Thank you so much, Dr. Matthew Norton. It's a privilege to be here with you today.
Well, thank you. I've been looking forward to this conversation, and I have to say, cracking the crazy maker's code. I love that. I love the multiple C's because I'm a person who appreciates those elements, and it sounds like a compelling title. So, given that compelling title of this forthcoming book and the work that you do, I would love to have some context, a little bit of background maybe that you can share with everybody who's watching, listening to us about how you got to this point. What's your story that informs this and makes you passionate about this topic?
Well, thank you. That's a big question, and I appreciate that you too are a literary nerd and like alliteration. So I think the title rolls well together.
Yes.
And what it means is cracking the crazy maker's code is developing a recognition of the people, the places, the cultural, the religious, all the ideas that we come up with, some of which are great and reinforcing and positive, and others that really get in our way as people trying to have relationships and professional dynamics that are comfortable and positive and forward rather than overwhelming. And as a young person, I had an extreme issue with anxiety. I was diagnosed with panic disorder and agoraphobia in my early 20s. Mm-hmm. And I had no idea really how to identify my emotions at that point. I couldn't even name them and explain them to you. Mm-hmm. So I got connected with a wonderful therapist at that point, and I have had quite a journey with therapy and medication. Excuse me, not so much medication, meditation. I have used medication for a short time in the past, and that's helped. Everything has helped me that I've been involved with. But in order to sort of recraft my life following that diagnosis and the very limited way I was living, I made a commitment. And when I went to college, it was my turning point. Was I went to my first year of college and made it through my first semester, but my anxiety was so intense that I was unable to attend some of my classes, and I dropped out after the first semester. And based on my family background, for me to get to college in the first place was a gigantic accomplishment, and to have to go back was a very, very deep wound that made me at the time feel like I wanted to commit suicide. No. So when I realized I needed help, I got that help, and I have spent the rest of my adult days figuring out what the roots are, who the crazy makers are, who and what they are. They're not always just people that get under our skin, that sort of helped us craft the negativity that we can get stuck in. And being a high drive, high intellect sort of person, I want to work with the professionals more who are struggling with some of these issues and maybe not realize it. If I look at statistics of the people in professions most likely to be depressed or deal with suicidal ideation, dentists are among the top 3 every time. Yeah. And also with dental patients, I was a very highly anxious dental patient, struggling to find a dental situation I could be comfortable in. And I did, here in Colorado, find a wonderful dentist named Jackie Schaefer of Colorado Healthy Smiles in Lafayette, Colorado. She actually works with anxious patients specifically. So she and I have built a relationship. We intend to build a podcast of our own on this subject, because anxious dental patients struggle to get care and make the dental experience for practitioners extremely difficult.
Yeah. Wow, I think that that sounds like a needed podcast. So I'm glad you're in conversation like that. And I'm glad you found each other. I mean, that sounds like a very natural fit. I was going to ask you why the inspiration to when you talked about high level healthcare professionals, what drew you to that particular? I mean, clearly, I think you're right about what the research shows as far as dentists in from a mental health perspective a lot of the time. But what drew you specifically to that? Is there more that you want to say about that?
Sure. I was drawn specifically to the three domains you mentioned: dental, healthcare, and veterinary, all for specific reasons. Being a highly anxious young adult, I struggled, as I told you, to go to a dentist, stay in the chair, and then not completely lose my cookies dealing with the experience.
Mhm.
Also, in the healthcare realm, I have been, as light-skinned as I am, a dermatology patient far more often than I would like to say,
Hmm.
and having to have some skin surgeries through my life that were really hard for me to deal with. That became more of an anxious sort of situation for me. And recognizing that there are people like me, not exactly in the situation I am, maybe not to the degree that I have struggled with anxiety in those areas, but there are a lot of people who struggle. As my friend Jackie, the dentist, says, "Oh, I have men who get up off the chair saying everything's great, and there's so much sweat on their back that it's all
Hmm.
over the chair when they get
Hmm.
up."
Wow.
Because we're all kind of trying to hide it and get through things. And if we can just be open about it and get the help that we need with it. And so, and in addition, I've also been a veterinary technician in the past. So knowing that the last study that I saw came out in 2022, the top four professionals most likely to struggle with anxiety and suicidal ideation: dentists, physicians, law enforcement, and veterinarians, in that order.
Hmm.
And I thought, here I'm really looking at this lens, and I talk to these people. I'm very proactive as a patient and a client. And I talk to these people about what it's like for me, and how do you perceive this, dentist? How do you perceive this, dermatologist, working with someone like me? Wow, it's nerve-wracking. You make me nervous because you're anxious. This
Right.
isn't fun
Right.
for me.
Right.
Right. So if we can build more of a rapport and understanding and relationship around that, I think we can make the whole system better.
Yeah.
My
I
goal.
like that because we very much influence each other, right? To where my tone, my energy, my calm or my anxiety is very influential to others around me. And I know as somebody who has been a care provider, I know when I'm with people who are bring much more anxiety, fear, apprehension into that situation, it does make it harder for me. I can feel that. I want to speak to that to help overcome that, but also to understand where that's coming from so I can be a part of the solution in that moment for people. So I do know that, and I'm certain I've likely been somebody who brought that to somebody in my life as well from the other side. So um, cracking the crazy maker's code. So I'm still kind of coming back to my intrigue around that. Can you share a little bit about maybe some specific examples for crazy maker elements that those doctors and hygienists that'll be listening, probably mostly, but others in the dental profession that would be coming up for them? What are some relevant crazy maker elements that you could share about?
Okay. So the book is broken up into vignettes, in which I give examples of some of the things that I've dealt with in my own life. And then at the end of each chapter, there's a space for maybe something like this is a similar experience you've had, and how can try this idea for how you can look at this differently potentially. So it's a memoir, and it's also a stop and learn sort of book.
Mhm.
The crazy makers that could come into the mind of any practitioner: maybe old parental stuff. You're not good enough. Why don't you try harder? I don't think you are the person for this job.
Mm.
You know, the educational pressures that we grew up with. And then beyond, in the family, beyond parental, the generational stressors that people don't even recognize grandparents dealt with. They get passed on from wars, from racial incidents. There's all sorts of things that can be generationally passed on. And in my own experience, it's always helpful for an example. My dad was an alcoholic. My mom is, you would probably describe her as a borderline personality, a very unhappy person who struggled a lot. I have a brother who dealt with addiction, and that was a huge family brouhaha all the time. I'm the youngest, so all this was sort of on top of me.
Mhm.
And then you get into the profession as a dentist, and you have the pressures of making the clients happy, keeping your balance sheet working, managing your office, getting along with your staff, all of those pressures that can come down on someone who may be dealing with imposter syndrome or developing into burnout. And if we can understand this is where this stuff comes from, I can move that out. I can, when I say in my transformational coaching, it's not just setting a goal and reaching it, it's recrafting your existence, repurposing how you see yourself in your own life, and can help other people to also be elevated. So the book is looking at the sort of historical, family, and generational crazy making stuff that we all absorb on different levels,
Mhm.
right? And then that educational first, and then professional pressure on dentists who tend to be, and dental professionals who tend to be a high level, put high level pressure on themselves, right? Often tend to be introverts,
Mhm.
which is interesting. So you
Right.
have to show up and be
Right.
ready for that patient and be on. That's not easy.
Right, right.
It's easy. Yeah.
Not knowing maybe what's coming your way in that encounter, what everything from the clinical need to just what's going to occur in the people dynamic, the relational dynamic there, with a lack of ability to really prepare fully in advance, which introverts would prefer to be able to be a little more organized and prepared in advance, right?
Yes.
So given the fact that the likelihood then that many people who would be prone to having some anxiety experiences in their daily professional world, then that they are maybe not noticing some of this occurring, or might even be inclined to keep overcoming, like an element of denial, like I just need to overcome and keep going and push through. What are some clues that you might share for people to maybe see themselves a little more accurately for the dilemma that they are in, before we maybe talk about a few solution ideas, some strategies that have been helpful?
Okay. So some of the ways that I just need to, let's start there. Your phrase, I just need to. I just need to get more sleep. I just need to hire better people. I just need to be better at handling my own books, or I just need to find someone else to do that. I just need to get patients who can sit in the chair and deal with the work that needs to be done, and leave the office so that I'm not stretching this out for hours on end and losing money. I just have to, right? So I also look at people's nutrition. What are you eating in the morning before you go to work? Are you consuming a lot of caffeine? We all do that, and it's just accepted. Caffeine is a drug that makes people more anxious, right? Sugar is an excitotoxin. It makes us more anxious and less patient at times. So you have the anxious dental patient come into your office. You have no idea why they're anxious, probably. It's not an easy conversation to have, but sometimes we can just open that up a little bit. I recognize this is hard for you right now. What is there anything specific I can do to help you? And just validating
Hmm.
somebody's struggle. worldwide, all subjects, if we could validate each other's struggle, including our own, a little more gently, a little more openly, that could open the floodgates to a whole other way of interacting between dentist and patient.
Yeah, that's good. That's good. Yeah, I like that. If only I have clients that will say, you know, if only I could get different team members, or if only I could figure out how to retire and get out of this sooner, right? Like the needed solution is I just need to find a way to get to a level of success so I don't feel bound to even have to do this anymore. And to me, there's an awfully large percentage of people who are caught there. And I think it's because they haven't been able to maybe access some solution ideas or even just the basic awareness of where the struggle is, right? But to get solution ideas that you could help offer to say, I could stay in the game better, longer, if I just could see a way to thrive in it more rather than even to how am I going to get through this. So does that make sense to you? That it's kind of like give me the escape hatch because I just am not finding victory here.
Yeah, that really resonates because others that I've spoken with, reading that I've done on the struggles that dentists have, there is a lot of that. How do I either end this or back up from this? Here you've made this commitment to work in the dental industry. You've put yourself through all this education. You've created everything to have potentially your own business or, you know, something, a group business, however you're working that. And to get to that point in the middle of your career where it's like, what can I do to make this stop?
Right.
And this pressure, it makes me sad. I think it's heartbreaking. And I know it has a lot to do with what clients bring, because if you as a dentist could imagine yourself treating every patient that comes in who's completely relaxed. Hey, Dr. Norton, I'm good to go. What are we doing today? Oh, a crown, no problem. You know, and it gets done. If dentistry was like that every day, I don't think people would be feeling that burnout.
Good. Yeah.
I mean, that's a major piece. And so if we can look at how we can connect better with what's actually happening. And for dentists, there's now the dental service organizations, the DSOs, that can be helpful to take some of the management piece out so that dentists can focus on the work with the client that you do. And if I think people too in partnership, if people connect in partnership and trade off hours and days and times, so that, you know, being one of the biggest problems, right, is being alone.
Right.
Being the solopreneur dentist. And you're the only one, and it all comes down to you. And there's no one to talk to about it, really. There's no one to kind of share the load at that level. Not to say all the staff isn't sharing a load. I know all the other staff is doing the heavy lifting. But at the level of the dentists themselves, there's got to be a better way to organize it than the solopreneur dealing with everything.
Right.
By himself.
Yeah, that is a lot of weight to carry to ultimately, I think a lot of times feel like I'm the one not only that needs to deliver the service, but I have to get people to say yes. I have to get people to follow through and take action on what I'm recommending. And for many, they would not see themselves as natural salespeople, right? And don't necessarily like the idea of sales, although we're all in sales all the time. I like to reframe sales as ethical influence, and that there's people in need in front of us that need expert guidance to be able to say yes, to receive the solutions that they're looking for. But it does require a degree of seeing the role as being influencers, and yet somehow combining that with a degree of kind of open-handed surrender to allow other people to take the action that they're willing and able to take at that point in time, and allow that, do your best influencing for their best good, and then to a bit more trust and release is something that I've found that can be really helpful, and not have to carry the pressure like it's not going to be okay. I'm very aware maybe of my financial needs. I'm aware of a need for people to grab a hold of everything I'm throwing out there for them because I need them. Not so much like my own needs get larger than the needs of the people that are in front of me, and then that becomes problematic. So at least that's some of my experience and some of how I've tried to kind of contribute to other people, maybe being able to carry that more lightly than they tend to carry it. What are some, as we kind of head into final bits of our conversation, because as I mentioned when we got started, the time goes so quickly. What are what other tips or strategies? Well, maybe tell me this first. What would you say you would like your impact to be as you contribute to these challenges that we're talking about? You specifically, how would you like to have an impact?
Okay, well, let me just harken back to a minute to that dirty word, sales.
Okay.
Yeah, dirty word. Everybody has a little agita around the word sales, don't we?
Yes.
Me too. And I like the way that you term it as an ethical influence. If we don't sell to each other, nothing gets done. I wouldn't be sitting here in front of my computer on a chair in my home if all those people are doing all their sales, right?
Right.
And it's the same thing when we're talking about trying to help people in the social emotional world as well. So yeah, sales does not need to be a dirty word, but I think ethical influence is a whole lot more
yeah.
to think of it. And so for my impact, I've been a therapist since 2005. Straight up focusing on that. Recognizing the limitations is the state of Colorado at this point in my world. Knowing that the need in the subject we're discussing is everywhere. So now I'm moving into adding coaching to that so that I can legally work outside of Colorado, not be quite in the therapeutic realm, but still working with what do you bring, what do you need, how can we help you move forward. Also, I have not stepped into this yet, but it's right here. I'd like to work with dental groups to help train professionals to work more effectively with their patients. For some of us, it's natural. Just having a relaxing conversation, talking about feelings and struggles, and it's natural. For a lot of people, and a lot of people in this profession, it isn't. Right. And they don't really know what questions to ask or where to start with what's happening with their patient and how to make that work better. So I'm committing myself to that type of training, and I'm working on that, starting to develop that idea now that I could help train dentists be able to make more of a connection, even if it's not easy in their wheelhouse. Naturally, it can be created to help validate where the patient is depending on how much they want to share. But even just hearing, I can understand that you are in this place right now. I see that this is a struggle. Here's a thing that seems completely inane to say this, but it's a huge issue if it's not done. You're in the dental chair. A dentist knows exactly what their tools are, what their movements are. They're doing their thing. If they could back up just long enough to say to that patient, now I'm going to, and I'm going to do this thing now. It might feel like this. To prepare the patient for each one of those moves becomes so naturally and isn't really thought about anymore. But, with a dentist, it can but to slow down enough to reassure the patient. Because I know myself, I'm in the chair. Oh, what do you got in your hand? What are you doing? No, what's that going to feel like? Wait, what's it? I know what that feels like. And so I've worked with Dr. Jackie on this. She's helped me greatly as a patient. I'm helping her as a practitioner to see this through this lens, more clearly. And even just that, just preparing the patient for every move that you make so they know what's coming and you never surprise them with anything, is enormous for everyone, whether they, are truly dealing with anxiety or not. It just is it's a view. Here it is, right? With your mouth hanging open and all the stuff out of it. And that's all you've got. And all this is going on around the patient. So let us know.
Yes.
Man, I mean, that's just one simple strategy.
Yeah, I like that a lot. And I think that was worth the price of admission right there for everybody who's watching, because I do think that's true. When we become expert at something, we sometimes will lose track. It's not uncommon to lose track that the other people around us that we're speaking to, they don't know our language of expertise, and they don't know what we're doing and what's coming. And given how much anxiety there tends to be with dentistry, and even the inability to emotionally cope sometimes with the findings and having to be shown and having to emotionally absorb the magnitude of I've had this experience myself, the magnitude of what the need is for something.
Mm-hmm.
When you didn't think that was necessarily what was going to be required, and like, what is this going to mean now? And I think it's important for doctors to be emotionally more sensitive to knowing that that's hard. And once overwhelm begins to kick in, I can't even hear what you're saying after like 2 minutes ago. I stopped hearing all of your recommendations because you didn't see that I went into overwhelm mode at that point. I think that's awesome. I think that that's a powerful contribution for you to make. Great for you to make, and in partnering with a dentist that is focused and interested in that. I think there's a lot of power in that. So I look forward to kind of keeping in touch and even seeing how all of that goes and what breakthrough contributions you can make. I'd like to, before we wrap up, could you tell us just a little bit about some of what might be unique in your offerings, unique in your therapeutic endeavors that you present for clients that you would work with?
Absolutely. And unique is a good way to describe me as a therapeutic professional.
In looking at your website, that word came to mind, so go ahead.
When I started my practice in 2005 as an alternative to the old playbook of talk therapy and medication alone. Not to say that they don't work. I spent plenty of time in talk therapy and a little time in medication, and those things pushed me forward at the time in my life. And I recognized there was more to that, more than that to it. So I've done a lot of other exploring and work. But at that point in 2005, when I started my practice, it was as an alternative to help people ground themselves and find comfort. And what I started with at that point was reconnecting to nature. There are studies all over the place, and I could certainly send one to you if you want to see it, on the nature pill. The nature pill is actually prescribed by some doctors to patients to get reconnected. We're so in our little world, sitting in our computers and driving our cars, and we're so disconnected with our own human roots, our own connection to nature and earth. And some people will look at that and think, well, what's that got to do with dentistry? Everything. Because if we don't have that grounding place to relax and sort of regenerate, rejuvenate ourselves, then we're just spinning the hamster wheel. The nature pill, the actual prescription, the studies have come to find that 20 minutes a day in nature, and that can be a backyard full of trees even, it doesn't need to be, although getting out in the mountains is great for you, out to the beach. 20 minutes a day is optimal for being able to help settle. Anything less isn't enough. Anything more is just an extra benefit. But 20 minutes a day seems to be a window that helps people reconnect. In addition to working with people outdoors, I often do that. I have developed back in 2006 wildlife imagery as a therapeutic modality. And people can say, well, what? A picture of what? It's almost, this is the most simplistic view. It's almost like an imaginary friend, if we've all heard of that type of thing. But what we bring is working through imagery, not to tell the client or the patient, this is an animal you should focus on. But I talk with them about what their nature attractions are, what animals they're attracted to, and why. And then I use indigenous people's practice ideas about the powers of those animals to help people see and feel what they need. So for example, I have 6 spirit animals that I use that help me in things like having to have an MRI, sitting through a root canal, been through that one. And I see the power of wolf as protection, and the power of snake as clearing a path, and hawk as seeing things from a more global perspective. Those are specific powers those animals bring. And when I actually focus on them in a situation that I'm struggling, it helps me to stay calm. And I have clients who have a great success with, I had a woman who couldn't go swimming. I mean, couldn't in a pool, was afraid to sit in the bathtub after she saw Jaws in 1980. Wow. Just the movie. That's all it took. Maybe it was 78. I was the same age as she was when I saw it for the first time too, I remember. And she ended up coming up with a pod of dolphins, because a pod of dolphins can beat a shark anytime. She would take her pod with her. She was able to go to the YMCA and get back in a pool. She would be surrounded by her dolphins. For some people, this is a reach. Yeah. For indigenous cultures, the spirituality and the psychology of earth connection is everyday useful stuff. So that's where it started. And then I also moved into EFT, emotional freedom techniques. Some people might have heard of it as tapping, which combines the Chinese meridian system and acupressure with EMDR practices together. It's incredibly effective, and it helps talk therapy move forward at about 3 times the rate. I have experienced that as a patient. I have had work with clients who have had trauma and ideas stuck for years and years they couldn't get rid of, and work through them with the EFT tapping on those subjects, and poof, they're no longer a problem. They no longer will bring anxiety up in people. So those are 2 modalities I focus in a lot now: wildlife imagery and EFT together. It's probably the top 2 that are working. So I am unique and alternative. But energy psychology, EFT is an energy psychology, fully evidence-based, fully studied now, largely in veterans populations and dealing with trauma. It's amazing stuff.
Yeah, that's great. Well, I'm glad you're doing all that. Thanks for sharing that. And what is a reach for people? It's something that's outside of their normal purview, right? If it's not our background training, we don't really know much about it, then almost anything can be a reach. So
sure.
So thank you for bringing us a little bit of that expansion of possibility there in that conversation. So for all the people who are listening, who are saying, wow, this is unique, this is something that maybe I have a need or might and could want to find out more, what's the best way for people to get in touch with you?
Well, the 2 best ways for professionals to get in touch with me is on LinkedIn. Okay. And then I have a rather lengthy URL, but on my website, I have a contact page, and it'll ask what you're, quote, looking for. You can ignore that if you just want to send me a note. I have a question, I want to find out more, or you can go through that form. But my URL is Bonnie Brindle Therapeutic Education.com. Okay. Yeah, so Bonnie Brindle Therapeutic Education.com. You can hop on my website, read a little bit more about the work that I do with high-level healthcare professionals, and leave me a note. No spam, ever. Awesome. Well, I appreciate your time. Thank you for your contribution. I know the need is great, and I know there's people listening who are thinking, okay, all right, maybe it's time right now to look into this a little more closely and see if I can get a little bit of help. So thank you for that, and hopefully they will they'll reach out, connect with you. So, and I look forward to your book. I'm anxious to see. I'm anxious. I'm anxious to see what your book has to say about being anxious. there are great ways of being anxious, and
Yes.
sometimes it's very useful to have a little anxiety when you're
Yes.
stepping into something.
Yes, yes.
When it's overwhelming and debilitating, then we want to work on it.
Yeah, enthusiasm and anxiety kind of, there's a line there. So
Yes.
the positive and negative side. So thank you so much for your time, and thank you everyone for listening and for being with us. This is the Truth Behind Dentistry podcast with Matthew Norton, and I've been with Bonnie Brindle. And I hope you found this this engaging, and I hope that you've gotten some answers today. I look forward to seeing you on our next episode. Thank you.